everyone. Thank you for coming today to this very big session. I'm very impressed with how many attendees there are here today. So as Emily just introduced, I'm Dr. Patanjali, one of the radiation oncologists from Chris O'Brien Lifehouse. One of my specialty areas is treating prostate cancer. So today that's going to be the main focus of my talk, together with some new imaging tests that we have to help us treating prostate cancer.
大家好啦，首先好多謝大家嘅來臨啦。咁好似啱啱 Emily 介紹咁樣啦，我係呢一個 Chris O'Brien Lifehouse 醫院嘅醫生啦。咁我係一名嘅呢一個放射腫瘤嘅醫生嚟嘅，專長咧係通過放射性嘅治療咧嚟到治療呢一個前列腺嘅癌症嘅。咁所以今日會同大家講下一啲相關嘅治療方法啦，同埋喺我哋嘅呢一個醫學嘅影像方面嘅一啲研究同埋進展嘅。
So today I'd like to start with some basic facts about the prostate. The prostate is a very small gland in men. It is located within the groin and pelvis area, between the bladder and the back passage.
咁首先咧，我同大家簡單咁樣講解一下我哋嘅呢一個前列腺啦。前列腺係我哋男性嘅一個小嘅腺體啦，咁佢咧係我哋嘅人體一個器官，位於我哋嘅大髀罅同埋盤骨深處之間。咁佢喺我哋膀胱嘅底部咧，同埋係我哋直腸嘅前方嘅。
So its location is here between the bladder and the back passage. And its main function is to produce some fluid. It is called prostatic fluid, and it makes part of the seminal fluid. And this is important for reproduction, to help the sperm travel and to survive.
咁好似我哋呢個圖片睇到咁樣啦，我哋嘅前列腺咧就喺我哋膀胱同埋後邊直腸嘅之間嘅。咁佢對於我哋成個生殖系統係重要嘅一個部分同埋器官啦。佢係提供咗精液嘅一部分，係有助於我哋精液喺入邊嘅精子咧嘅呢一個傳播同埋輸送嘅。
Prostate cancer is when there are abnormal cells in the prostate and they grow in an uncontrolled way and they form a tumour. It is a very common cancer.
我哋前列腺癌咧，其實就係我哋有呢一個異常嘅呢一個細胞啦，或者異常細胞喺唔受控嘅情況底下咧，去生長嘅，到最後咧就係會形成我哋嘅呢一個腫瘤啦。咁喺目前嚟講咧，前列腺癌咧係一種好常見嘅癌症嚟㗎。
In Australia, it is estimated nearly 25,000 men were diagnosed with prostate cancer last year, and the average age of diagnosis of these men was 69 years of age.
喺澳洲嚟講咧，舊年有超過25,000名嘅男性咧係被診斷出有前列腺癌嘅，而且佢哋診斷出嘅平均年齡咧係69歲嘅。
Prostate cancer is the most commonly diagnosed cancer in Australia. It is estimated that 1 in 6 men will be diagnosed with prostate cancer by the time they reach 85 years of age.
前列腺癌喺目前澳大利亞嚟講咧係好常見嘅呢一個癌症之一啦。咁根據估計咧，喺每6個男性當中咧，喺佢哋到85歲嘅時候，其中就會有1名男性係被確診有前列腺癌嘅。
Early, or what we call localized prostate cancer, is when the cancer cells have grown abnormally, but they have not spread outside of the prostate.
我哋早期或者係局部性嘅呢個前列腺癌咧，係指佢有癌細胞生長異常啦，但係佢哋仍然係未擴散到去前列腺之外嘅任何器官或者位置嘅。
Advanced prostate cancer is when there is either disease that has spread outside of the prostate to other parts of the glands close to the prostate, such as the seminal vesicles or lymph glands.
咁我哋晚期嘅呢一個前列腺癌咧，就係指我哋嘅呢一個前列腺癌，佢嘅呢個癌細胞咧已經係擴散到前列腺以外嘅一啲身體嘅部位啦，或者係靠近我哋前列腺嘅一啲腺體，譬如話好似係經絡或者係淋巴腺嘅。
The most advanced prostate cancer is what we call metastatic prostate cancer. This is when the cancer has spread far outside of the prostate and pelvis area to distant parts of the body, such as the bone and the liver and the lung.
咁最後一種係屬於最嚴重或者最晚期嘅前列腺癌咧，就係我哋稱作為呢一個轉移性嘅前列腺癌啦。咁呢一種嘅情況咧，就係意味着癌細胞咧已經去擴散到身體比較遙遠或者唔同嘅部位啦，譬如話好似我哋嘅骨骼、肝臟、肺部等等嘅位置嘅。
So in this diagram, you can see that in the light blue, this is where the prostate cancer has started, and then as it spreads, it can go into the gland called the seminal vesicle, into the bladder, into these areas called the lymph glands here, and then eventually it might actually go into the rib area and spread to the bone.
咁喺呢幅圖入邊，我哋可以睇到啦，比較靠下邊嘅淺藍色嘅位置就係一開始我哋前列腺癌症開始嘅地方啦。咁再往上，佢可能已經係慢慢係擴散到去鄰近嘅一啲腺體啦，譬如淋巴腺啊、膀胱啊等等啦。再往上，可能癌細胞已經係入侵到我哋啲肋骨，已經入咗去，造成我哋呢個骨方面或者骨頭方面嘅呢一個擴散嘅。
We want to diagnose the prostate cancer when it is in this area or even in the lymph glands. But once it goes further and spreads outside to the liver and the bone, it is not curable.
所以我哋嘅目的係希望可以喺較早期嘅時候，當我哋癌症仍然係未擴散或者淨係擴散到鄰近嘅淋巴腺之前，就係診斷佢出嚟啦。因為當我哋嘅癌細胞如果係轉移到去比較遠嘅地方，譬如話肝臟或者骨骼嘅話，咁喺呢種情況底下，前列腺癌就係唔可以根治㗎啦。
What are the signs and symptoms of prostate cancer? So for most men with early prostate cancer, usually they have very little, if any, symptoms. So for a lot of men, it is picked up on a blood test with your local doctor.
咁前列腺癌會有一啲咩嘅症狀呢？其實一般嚟講咧，如果係比較早期嘅話咧，大部分嘅男士咧，可能喺一開始嘅時候咧，都係會冇或者係得好少症狀嘅啫。好多時候確診咧係通過佢哋去見家庭醫生嘅時候驗血驗出嚟嘅。
More advanced prostate cancer can present with symptoms in the prostate, such as poor stream or flow of the urine,very frequent urination, pain or burning or blood in the urine, and then more advanced disease, pain in the back, in the pelvis, in the ribs, weak legs or feet.
咁其他嘅一啲症狀咧，就包括我哋尿頻啦、小便冇力啦，我哋小便嘅時候會感覺到灼熱啦、痛啦，或者係尿中帶血嘅，甚至有時我哋會覺得係背部啦或者盤骨係有包括肋骨有痛楚啦，或者下肢無力嘅。
When the cancer is very advanced, then men have tiredness, fatigue, pain, and often weight loss.
咁當係比較晚期嘅時候咧，患者可能就會感覺到比較疲倦啦，個人覺得好攰啦，甚至係體重下降嘅。
What test do we do, or what test does your GP do to pick up prostate cancer? So your local doctor might recommend doing a rectal examination, which is pictured here, where the finger is used to feel what the prostate feels like.
咁我哋會有一啲咩嘅檢查方式呢？咁如果係一開始嘅時候，譬如係家庭醫生啦，去揾家庭醫生嘅時候，可能佢哋會建議做一個直腸嘅呢一個檢查啦。咁亦都係圖片顯示咁樣，醫生會將手指通過肛門插入去檢查一下呢一個前列腺嘅狀態嘅。
With the finger, you can feel whether the prostate is hard or soft, or whether it has felt like the disease has spread outside of the prostate.
通過呢一個直接用手指感覺嘅方法咧，醫生可以睇下前列腺係硬或者係軟啦，從而判斷咧佢呢一個有冇任何嘅問題或者癌症啦，甚至係癌症有冇擴散到去身體其他嘅部位嘅。
One of the easiest tests to do is the PSA blood test, what we call prostatic specific antigen, which your GP can do very easily on a routine blood test.
其中一個比較容易啲嘅方法就係我哋嘅呢一個 PSA 嘅驗血啦，亦都係我哋嘅前列腺嘅呢一個特異性抗原嘅血液測試。咁喺家庭醫生嗰度咧就已經可以做㗎啦。家庭醫生亦都可以定期咧喺驗血嘅時候幫大家睇下呢個 PSA 嘅情況嘅。
Often, if your local doctor finds an abnormal test when they feel the prostate or an abnormal blood test, they will refer you to a surgeon, a urologist, or an oncologist for these further tests.
咁當家庭醫生佢可能做完一啲無論係我哋啱啱講到嘅直腸檢查啦，或者係血液檢查之後，發現有一啲異常之後咧，好多時候家庭醫生都會轉介你去見根據情況而定啦，外科醫生、我哋嘅泌尿科專科醫生或者係腫瘤科醫生嚟到再接下來呢啲進一步嘅檢查嘅。
The surgeon or urologist often does an ultrasound through the back passage, at the same time can put a needle into the prostate to do a biopsy and find out whether there is prostate cancer within the prostate.
哋手術科外科醫生或者係泌尿科醫生咧，好多時候係會做一個前列腺嘅超聲波啦，跟住嚟到睇下入邊嘅呢個情況嘅。好多時候通過呢個方法，佢哋同時可以幫你做一個活體檢查啦，抽取一啲異常嘅組織去化驗，睇下係咪有呢一個癌變嘅。
The biopsy will tell the surgeon whether there is definitely prostate cancer present, and then the CT scan, the MRI, and a bone scan or a PET scan can be done to see whether the prostate cancer remains in the prostate or whether it has spread outside.
我哋活體檢查嘅結果咧，就可以嚟到確診或者俾醫生知道究竟係咪有呢個前列腺癌啦。咁通過其他嘅一啲影像嘅測試，其中包括我哋嘅核磁共振啦、電腦掃描啦、正子掃描啦等等，都可以嚟到俾醫生知道究竟目前嘅癌症係仍然處於初期或者係局部性嘅，淨係已經擴散到身體其他嘅部位嘅。
The CT scan here and the MRI give us very good pictures of what the prostate looks like. The bone scan and the PET scan show us the whole body, and it can show us disease particularly within the bone.
我哋嘅 CT 或者電腦掃描，包括我哋核磁共振咧，可以俾我哋更加好咁樣睇到前列腺嘅情況啦。骨頭同埋正子嘅掃描咧，係我哋可以睇到全身，特別係骨頭入邊嘅呢一個具體情況係點樣嘅。
Unfortunately for these patients, the cancer has already spread to the bone. For this patient, there are a few spots in the bones, in the spine and the ribs particularly. For this patient, unfortunately, there are many spots within the bones, too many to count, and this is very advanced disease within the bone.
咁我哋可以睇到有幾個唔同嘅呢個 影像俾大家睇下啦，就係有啲黑點嘅話，其實就係已經係擴散咗嘅癌症啦。有啲我哋見到已經喺骨頭啊、肋骨度已經係有呢個轉移嘅跡象嘅，有啲甚至喺我哋嘅呢個盤骨啦，或者其他嘅一啲內臟。最右邊嗰個我哋可以見到已經係擴散到去好多唔同嘅部位，喺呢種情況之下就係已經比較難治癒㗎啦。
The types of scans and imaging, many years we have been using ultrasound, CT scan and bone scan. The ultrasound, which is shown up here, shows a very good picture of the prostate, shows the size of the prostate, but does not really show where the cancer is in the prostate.
咁我哋依家講嘅呢幾種唔同嘅掃描或者影像測試咧，就已經係用咗好多年㗎啦。其中就包括超聲波啦、CT 掃描啦，同埋全身嘅骨顯像嘅。超聲波嘅話咧，佢嘅好處係我哋可以比較直觀咁樣睇到前列腺嘅呢個情況啦，佢嘅大細啦，但係我哋係睇唔到癌症係處於佢前列腺入邊嘅乜嘢位置㗎。
The CT scan shown here can show the prostate very well. It can also show the rectum, the bladder, the bones, the liver and the lungs.
CT 掃描咧，電腦掃描就可以睇到前列腺啦，同埋佢附近嘅一啲器官嘅，包括我哋嘅膀胱啦、直腸啦、骨骼啦、肝臟啦、我哋嘅淋巴腺啦等等嘅。
The bone scan, as mentioned, looks specifically at the bone. It is not good at looking at the prostate or the lymph glands or other areas such as the liver or the lungs.
我哋骨頭嘅呢一個顯像咧，或者掃描咧，之前亦都有講到過啦。佢係針對於我哋睇下骨頭嘅情況嘅。喺呢一種掃描情況底下，可能就係冇辦法好清楚咁睇到前列腺，包括佢附近嘅一啲腺體，好似我哋嘅淋巴腺嘅呢個具體嘅情況㗎。
So when a man is diagnosed with prostate cancer, we use a combination of scans to get the best picture as to how extensive the prostate cancer is.
所以當一名男士一開始被診斷出有前列腺癌嘅時候，醫生可能都會叫佢做好多種唔同嘅呢一啲掃描或者檢查啦，因為我哋通過唔同嘅呢一啲檢查，先至可以清楚咁樣了解到病情嘅呢一個情況同埋嚴重程度㗎。
More recently, in the last couple of years, Medicare has funded multi-parametric MRI. The MRI scan is a very detailed scan of the prostate, and it helps show us where the cancer lesions are and also helps the surgeon target where to do the biopsy.
咁喺過去幾年咧，好嘅消息就係我哋有一啲比較新型啲嘅呢一個核磁共振啦，多參數嘅核磁共振。咁而家目前咧，亦都係 Medicare 咧係可以報銷嘅。佢係一種特殊嘅核磁共振啦，咁佢可以提供俾醫生見到一個更加清晰嘅呢一個影像。咁同時亦都可以幫助我哋嘅外科醫生咧，究竟喺做活檢嘅時候咧，要點樣去落針嘅。
So in this scan here, you can see that the cancerous lesion is very small. It is probably only about a centimetre. The prostate is shown as a large gland here, but the MRI is very good at picking up these very, very small lesions, and then the surgeon can come and put the needle in there to diagnose the prostate cancer.
所以好似呢個張圖片顯示咁樣啦，雖然可能比較難見到我哋嘅呢個癌症嘅病灶咧係好細啦，特別係相對於我哋嘅前列腺，佢可能唔到1公分啦。咁但係呢啲嘅比較新科技嘅核磁共振咧，仍然係可以睇得到嘅，同埋可以清楚咁樣話俾我哋外科醫生聽，要喺呢一個位置落針嚟到幫病人進行活檢，再進一步去化驗睇下究竟係唔係。
The most recent scan and the most advanced or sensitive scan we have is called a PSMA PET scan. So this refers to a prostatic specific membrane antigen PET scan.
我哋比較最新前嘅呢一個掃描咧，係一種叫做 PSMA 嘅正子呢一個掃描，佢係一種專門係被稱作為前列腺嘅特形性嘅呢一個膜抗原嘅蛋白質嘅一種掃描嚟嘅。
On a PSMA PET scan, we can see deposits of cancer as We can see deposits of cancer as small as 2 millimeters, so it can pick up cancer spread in the very early stages.
喺呢一種新型同埋特別嘅正子掃描嘅情況咧，我哋係可以見到一啲好細到可能係2毫米嘅呢一個癌症咧，都係可以睇得到嘅。所以我哋係可以喺佢開始擴散比較早期嘅時候咧，就可以檢驗到出嚟。
So we use PSMA PET scans as part of the initial staging for men with more aggressive prostate cancers, for men who have a few limited sites of spread, what we call oligometastatic disease, and also men whose PSA blood test starts to rise after they've had surgery or radiation, where we are looking to see whether the cancer has reappeared.
所以呢一種正子掃描咧，喺以下嘅呢種情況咧，係我哋一般會採用嘅。係首先對於嗰啲患有局部但係比較高危風險類型嘅前列腺嘅病患者咧，我哋嚟到做一個初步嘅分期啦，同埋係對於嗰啲幾個有限擴散部位嘅男性，醫學上稱為小轉移嘅我哋嘅患者啦，同埋對於初次治療之後 PSA 復發嘅男性咧，我哋可以用呢一種嘅正子掃描咧，發現出現癌症嘅呢一個疾病嘅位置㗎。
So these PET scan images show normal uptake in the kidneys in both these scans, but abnormal uptake in many lymph glands all the way up into the chest and also into the neck.
所以我哋圖片當中見到啦，可能我哋一開始係覺得可能呢一個腎臟係冇問題嘅，但係做咗正電子嘅呢一種特別嘅掃描之後咧，係可以發現包括我哋圖片顯示咁樣咧，喺頸部嘅位置啦、心口中間，甚至係臨近嘅一啲淋巴腺咧，都係已經出現咗病變嘅。
Last year's EUA or European Urology Guidelines have recognised that the PSMA PET scan imaging in the diagnosis of prostate cancer. So they have recognised how useful this scan is, and fortunately for Australian patients, Medicare also funds PSMA PET scans.
喺舊年我哋嘅 EAU 亦都係我哋歐洲嘅呢一個泌尿科嘅協會咧，佢出嘅報告當中亦都有建議到係將呢一個 PSMA 嘅正子掃描咧，係用作嚟到診斷呢一個前列腺嘅癌症嘅。咁喺澳洲咧，大家就係比較幸運，因為目前呢一種嘅正子掃描咧，已經係納入咗 Medicare 報銷嘅範圍㗎啦。
Now we go on to treatment of prostate cancer. So there are many treatments available for men with prostate cancer, depending on how advanced the prostate cancer is and also the patient preference.
咁接下來同大家介紹一下目前嘅一啲治療方案啦。對於患有前列腺癌嘅病患嚟講咧，目前根據佢哋個人嘅呢一個意願啦，佢病嘅呢一個嚴重程度啦，都係有好多唔同嘅治療方案可以選擇嘅。
Today I'm focusing on the radiation treatments, so I won't be talking about active surveillance, hormone therapy, or surgery, which is radical prostatectomy.
所以我哋今日嘅呢一個分享咧，最主要都係同大家介紹一下放射治療法方面嘅呢一啲嘅治療方案啦。所以其他嘅一啲治療方案，譬如話好似我哋去監控佢啊，或者係一啲激素或者荷爾蒙治療法啦，甚至係我哋外科手術，亦都係我哋成日講嘅前列腺切除手術咧，我哋今日就先唔講住嘅。
The types of radiation therapy include what we call external beam radiation, which is the most common form of radiation throughout the world.
我哋放射性嘅治療咧，其實亦都係有好多唔同嘅種類嘅。其中首先包括第一種我哋嘅外觸放射治療咧，就係喺世界範圍之內我哋最常見或者最常聽到嘅放射療法嚟嘅。
I will also discuss much less common and much more specialized radiation treatments of brachytherapy rods, brachytherapy seeds, and also proton radiation and cyberknife.
跟住之後，亦都會同大家介紹一下冇咁常見，而且係呢一個比較專業啲嘅我哋呢個高劑量嘅近距離放射治療啦，或者係低劑量嘅近距離嘅放射治療，包括我哋嘅質子放射治療同埋射波刀嘅。
So the most common form of radiation is external beam radiation, and this is delivered via a machine called a LINAC or a linear accelerator.
我哋首先第一種咧，亦都係大家最常見同埋聽到嘅就係外觸嘅呢一個放射治療啦。咁呢一個係我哋會用到一個圖片當中顯示嘅呢一個機器啦，我哋嘅直線加速器嚟到做嘅。
So in this machine, the X-ray radiation comes from this part of the machine and is targeted to certain areas in the patient's body.
所以喺圖片顯示咁樣，我哋嘅專科嘅醫生就係會校好我哋嘅劑量同埋角度啦，跟住通過呢一個外在嘅機器，將一啲放射性嘅打入去我哋嘅人體內咧，跟住去影響嗰個局部嘅位置嘅。
This machine moves 360 degrees around the patient to aim the radiation beam from any angle.
跟住我哋呢部機器係可以旋轉360度，所以係喺可以任何嘅角度將呢一啲嘅我哋外觸嘅放射性嘅光束咧係輸入去病人體內嘅。
So when you come for radiation treatment, your team will include a doctor called a radiation oncologist, there will be trainees called registrars, there will be therapists who are on the machine to help with the treatment, physics staff and nursing staff.
當你嚟到醫院要去接受我哋嘅呢個治療嘅時候咧，我哋都係會有一個團隊咁樣嚟到去提供呢一個醫療嘅服務嘅。咁治療嘅團隊當中咧，就會包括有一名嘅放射科嘅腫瘤專科醫生啦，我哋會有專科嘅培訓醫生啦，放射治療師，我哋嘅物理學家同埋護理人員嘅。
The external beam radiation treatment for prostate cancer is what we call fractionated treatment, which means that it's given over multiple days, but only 10 to 15 minutes per day.
我哋前列腺嘅呢一種體外觸嘅放射治療咧，係一個我哋稱之為分階段嘅治療過程啦。喺每日只需要大概比較短嘅10到15分鐘嘅照射或者治療，但係佢呢一個照射係需要持續多天咁樣去治療嘅。
There are different ways the external radiation can be given depending on the type of prostate cancer. So this can be up to 7 to 8 weeks. There's a shorter version, which is about half of that, over 4 weeks, and even shorter still, half of that, over 2 weeks, that can be given in 5 days.
根據具體嘅病人嘅情況同埋前列腺癌嘅種類咧，佢呢個治療持續嘅時間咧，都係因病人而異嘅。一般嚟講，標準咧係持續4到8個星期左右啦，但係有時根據具體情況咧，可能係會短啲，譬如一半啦，4個星期左右，甚至有啲情況底下咧係更短嘅時間嘅。
There are many new techniques that we use called intensity modulated radiation, arc therapy, image guidance and image fusion, which are all aimed to help increase the dose we can give to the cancer and reduce the dose that we give to the normal organs.
咁喺過去嘅呢 幾年間咧，其實喺呢一方面都有一個比較重大嘅進展嘅，有好多比較新興嘅呢啲技術啦，包括強度調節嘅放射治療啦、圖像引導嘅放射治療等等。但係呢啲新型嘅我哋嘅呢啲發展咧，佢最主要嘅目的咧，都係希望通過我哋嘅科技同埋技術嚟到增大我哋針對癌症所受到嘅呢一個放射性治療嘅劑量，同時間減少佢附近器官或者身體部位所接受到嘅放射治療嘅呢個劑量嘅。
And some of the imaging tests I mentioned before, like MRI and PET scan, can actually be used in the radiation planning to help the oncologist focus the radiation down to the areas of the prostate cancer.
咁好多我哋包括之前講到嘅一啲檢查咧，包括核磁共振同埋正子掃描咧，其實都好多時候會一齊去做，或者將佢哋嘅圖像咧融合。目的咧就係幫助我哋嘅醫護人員，包括我哋嘅醫生咧，喺一開始做定位嘅時候咧，可以更加準確咁樣去定位到我哋嘅呢個前列腺所接受呢一個放射治療嘅呢一個位置嘅。
These newer technologies help us to treat patients more quickly, so sometimes even nowadays 10 minutes or less per day, just like having a normal X-ray.
呢啲比較新嘅技術咧，可以令到我哋嘅治療速度加快啦。依家好多嘅病人咧，可能每日嚟接受嘅呢個治療時間咧，都只係需要10分鐘到嘅啫。咁呢一個同我哋平時可能去照一個 X 光嘅時間咧，係差唔多嘅啫。
We want to focus the radiation more accurately to the prostate to help increase the cure rates, but also decrease the side effects to the bladder and the rectum.
我哋喺放射性嘅治療嘅呢個期間咧，我哋最主要想做到嘅都係可以更加精準咁樣聚焦喺我哋前列腺上邊啦。咁通過咁樣做咧，佢可以增加到我哋前列腺嘅劑量，而幫助提高我哋嘅治療率啦。同時間可以減少到對我哋前列腺周圍正常器官嘅一個劑量，減少病人所受到嘅副作用嘅。
So on the left here is what we call IMRT, or intensity modulated treatment, and this is arc therapy. Here you can see in red, that is where the high dose radiation is going to the prostate. The green and the blue is the much lower dose radiation, which is going to the tissues outside of the prostate.
咁喺呢個圖片咧，大家可以睇到啦，就係我哋常用嘅呢個體外嘅照射放射治療啦。中間紅色嘅部分咧，就係我哋受到呢個放射治療比較聚焦同埋集中嘅地方。旁邊綠色同埋藍色嘅位置，亦都係我哋身體佢附近同埋其他嘅部位咧，所受到嘅呢個放射治療嘅影響咧，係會比較淺啲嘅。
Similarly here, the white, yellow and red lines are the higher dose lines, and the blue line is the lower dose line. So what we want is high dose to the prostate area, but low dose to areas such as the rectum, which is here, and the hips on either side.
咁喺右邊嘅呢個圖片其實都係大同小異啦。我哋嘅紅色同埋黃色線咧係我哋嘅呢個放射治療比較集中嘅地方，藍色線咧係相對嚟講劑量比較低嘅地方。我哋希望可以做到係更加有針對性啦，將高劑量嘅放射治療咧集中翻喺前列腺癌嗰度，對於身體其他嘅一啲部位，譬如好似直腸咁咧，減少佢所受到嘅呢個劑量，從而減少之後嘅副作用嘅。
There are other forms of radiation where we treat the prostate cancer from inside the prostate. This is called brachytherapy.
當然有其他嘅呢一啲嘅我哋嘅放射性治療啦，咁呢一種就比較特別啲，有別於我哋啱啱講到係從外部進行治療，呢一種方式咧係由內部身體入邊進行治療嘅，亦都係我哋叫做嘅近距離放射治療。
In this type of brachytherapy, called seed brachytherapy, very small radioactive seeds, like rice grains, are placed within the prostate, as you can see here, up to 80 to 100 little radioactive seeds put inside the prostate.
咁特別係呢種種子式嘅近距離放射治療呢，醫生就係會將大概80到100粒左右嘅呢一種好似米粒大細嘅有放射性嘅種子呢，跟住擺喺我哋嘅體內同埋前列腺嘅附近嚟到進行治療嘅。
These metal seeds remain in the patient forever, but the radiation or the radioactivity reduces over time.
呢一種金屬嘅種子咧，擺咗入去之後咧，就係永久性，唔需要攞翻出嚟嘅。但係當然佢嘅放射性咧，會隨住時間咧係慢慢衰退嘅。
So by 10 to 12 months, there is basically no significant radiation.
呢啲種子喺經過大概10到12個月之後咧，基本上就唔會再有啲放射性㗎啦。
The other form of internal radiation or brachytherapy is called high dose rate or with rods or catheters.
另外一種嘅呢種近距離嘅放射治療咧，係屬於高劑量嘅近距離放射治療㗎。
These are not permanent, these are temporary catheters that are placed into the prostate in certain positions so that we can give a high dose to the prostate over a period of maybe 1 hour or 2 hours of a procedure, and then we take the rods out.
咁呢一種以導管形式嘅咧，就係唔會係永久性，而係暫時性嘅。我哋會將一個比較精細嘅導管放喺前列腺嘅部位啦，跟住用機器嚟到持續性咁樣將一啲比較高劑量嘅放射治療咧輸送入去，大概咧1到2個小時左右嘅。
Again, this is a way to give a very high dose to the cancer, but to reduce the dose to the tissues outside of the prostate.
呢種方法我哋嘅目的都係一樣啦，希望可以將我哋嘅呢啲放射治療比較高劑量咁樣去放到或者影響我哋想影響嘅前列腺癌症啦，而且對佢其他附近嘅組織或者器官係減少佢哋所受到嘅影響嘅。
Some people might have heard of a very specialized form of radiation called proton radiation therapy. It does not use X-rays. It uses a type of radiation called protons, which is a very specialized type of radiation not yet available in Australia.
有啲人可能聽過呢一個介子放射性嘅治療啦，佢係一種比較特殊類型嘅呢一種輻射嚟嘅，同我哋之前講到用 X 光係唔同啦。佢係叫做質子放射治療，但係目前嚟講咧，喺澳洲咧係仲未有呢一種技術嘅。
The aim of this specialized treatment with protons is to deliver a much more focused or targeted radiation to the prostate and minimize the radiation outside of the prostate.
呢一種特殊嘅放射治療咧，佢最主要嘅目的咧，其實都係相同嘅。我哋仍然都係希望可以更加有針對性同埋準確咁樣將呢啲輻射或者放射嘅治療針對喺我哋嘅呢個前列腺，而減少前列腺以外嘅一啲身體所接受到嘅輻射嘅劑量嘅。
So the machine for proton radiation is very similar to a linear accelerator. The protons will come from here and the rotation is 360 degrees around the patient. However, this is what the X-ray radiation plan looks like, and this is what a proton radiation plan looks like. So as you can see, the radiation dose is much more focused with the proton radiation.
咁我哋睇翻首先左手邊嘅機器咧，其實同我哋之前幾個圖片所見到嘅我哋傳統用嘅嗰種機器咧係差唔多嘅，佢都係可以旋轉360度喺任何角度咁樣進行治療啦。我哋如果睇翻右手邊嘅呢一個圖片咧，就可以見到佢哋之間嘅區別啦。 最右手邊嘅上下兩幅咧係我哋傳統嘅放射性治療啦，可以見到我哋身體有唔同嘅部位，或多或少都係會受到呢個輻射嘅影響嘅。但係左手邊咧嘅圖片咧顯示嘅就係質子放射治療，大家可以見到佢嘅劑量係更加集中啦，同埋身體前列腺以外嘅部位所接受到嘅輻射嘅劑量咧係低好多嘅。
Unfortunately, proton radiation machines are very expensive. So as a comparison, a normal X-ray linear accelerator could cost something like 2 to 3 million. A proton radiation machine can cost $40 or $50 million.
咁目前嚟講咧，呢啲新嘅科技嘅話，雖然佢哋效果好好，但係價錢咧亦都同時係好高昂嘅。我哋兩者如果進行一個對比嘅話咧，我哋傳統用 X 光嘅呢一啲直線加速器咧，可能每部機器嘅價錢係200萬到300萬左右啦。新型嘅呢種質子放射治療咧，佢哋每一部嘅呢一個價錢咧，可能係高達4到5千萬嘅。
So in Australia, the government has funded one proton centre. This will be operational in Adelaide. They are hoping to open in 2025. The building has already commenced, and this year and next year they will continue with the testing, but hopefully in 2 years' time there will be an operational proton centre in Australia.
咁目前咧，我哋嘅政府咧係有出資啦，資助係購買咗一部嘅呢一啲質子嘅放射治療咧，到時係會2025年嘅時候咧喺亞德萊德咧係投入呢個使用嘅。咁佢哋依家目前嚟講係已經係陸續咁樣去起緊啦，跟住希望喺2年之後2025年咧，我哋喺澳洲亞德萊德都會有一個新型嘅質子放射治療中心嘅。
Another very specialized machine to deliver radiation is called the CyberKnife system, and this is a type of radiation machine again to bring robotic precision to the delivery of radiation treatment.
好，另外一種可能比較少聽到嘅，我哋嘅呢一個射波刀啦，咁其實佢仍然呢一個系統咧，都係一種係利用咗目前我哋嘅機械人帶來嘅呢一個準確性，跟住都係希望我哋可以將呢一個放射性嘅治療或者輻射咧，更加有針對性同埋準確咁樣去達到我哋前列腺嘅位置嘅。
So this is a picture of the robotic guided arm, where the radiation comes and that arm moves around the patient. It can deliver radiation in many different angles, and it can actually move with the patient.
跟住呢一個圖片就係我哋嘅呢一個機器啦，佢本身機械人嘅話，佢有呢一個機械手臂，跟住喺唔同嘅角度去旋轉，包括病人本身亦都可以旋轉喺唔同嘅角度，將我哋嘅呢啲輻射或者放射治療係輸送到病人體內嘅。
So what this enables is using the robotic arm. With the breathing of the patient and the movement of the patient, the arm can follow the target of the prostate.
所以用咗呢一種嘅機械咧，或者我哋機械手臂咧，佢哋亦都係會隨着病人喐動，佢亦都可以係旋轉同埋喐動嚟到實時咁樣跟蹤病人同埋前列腺嘅呢個位置嘅。
At this stage, there is only one CyberKnife located in Australia, and that is located in Perth.
咁目前嚟講，澳洲咧亦都係得一個地方有射波刀嘅呢一種技術啦。咁而且佢係依家目前嗰個中心係位於珀斯嘅。
So today I've focused mainly on the prostate, treating the prostate cancer with aggressive radiation. But sometimes we need to treat after the surgeon has operated. This is called post-prostate radiation.
咁我哋今日咧，其實同大家講咗好多，特別係針對於放射性治療嘅呢一種嘅治療方案啦。咁好多時候都係嚟到通過用呢啲輻射或者放射治療咧，嚟到醫治呢一個前列腺癌嘅。 咁但係其實咧喺我哋現實生活當中咧，有時喺我哋嘅病患做咗手術之後，前列腺嘅切除手術之後咧，我哋亦都係會幫佢做一啲後續嘅呢一啲放射性嘅治療㗎。
So if there is cancer left behind after the surgery, there is no prostate here. We are actually treating the area where the prostate was.
喺做完手術之後，如果我哋仲發現係有呢一個癌細胞或者癌組織嘅話咧，我哋仍然都係會去用呢一個放射治療嚟到去治療病人嘅。嗰個位大家可以見到，可能因為前列腺已經係切除咗啦，但係如果仍然有癌細胞嘅話咧，我哋仍然都係會喺嗰個位置採用呢一個放射性嘅治療嘅。
Also, in the situation where prostate cancer has unfortunately spread, such as to the bone in the spine, we can give very focused radiation to areas within the spine, and here you can see in front of the spine there is the spinal cord, and we can protect the spinal cord from any significant radiation.
除此之外咧，我哋喺一啲比較前列腺晚期嘅病患嘅身上，當佢嘅呢一個前列腺嘅癌症可能已經擴散到去其他嘅一啲部位，譬如好似係我哋嘅呢一個脊椎啊等等嘅情況啦，我哋仍然都可以用呢一個放射性治療咧嚟到保護翻我哋嘅病患嘅呢一個脊椎啦，同埋嚟到係提供一啲舒緩方面嘅治療㗎。
So, in summary, prostate cancer is a very common cancer, but when we pick it up in its early stages, it is often very curable.
最後咧，作為同大家總結一下咧，就係前列腺癌咧係一種好常見嘅癌症嚟嘅，但係如果我哋可以喺比較早期嘅時候發現咧，通常咧係可以治愈㗎。
Radiotherapy is a very successful and well-tolerated form of curative treatment for prostate cancer, and many of these advancements in the technology I spoke about today will help improve cure rates and reduce side effects of this treatment.
放射性治療喺針對前列腺癌方面嚟講咧，已經係一種係比較成功，同埋對於病人嚟講咧，佢嘅呢一個耐受性係比較好嘅治療方式嚟嘅，包括特別好似啱啱同大家介紹咁樣喺呢一方面，無論係技術啊或者係成像啊，都係取得好大嘅呢一個進步嘅。咁所以對於提高治愈率同埋減少病人嘅副作用方面咧，呢一個放射治療都係比較好嘅一種選擇嚟嘅。
I think with radiotherapy especially, it is not just the doctor that helps cure your prostate cancer. It is a combination and a team effort with doctors, radiation therapists, physicists and nurses who are all here to help men with prostate cancer through their journey, through the diagnosis and the treatment, and also ensure that they have the best chance of curing their prostate cancer and also the best quality of life.
咁我哋呢一個放射性治療咧並唔係單兵作戰啦，係更多講求嘅係團隊合作嘅。咁我哋係需要有醫生、放射嘅治療師、我哋物理學家同埋護士等等，大家通力合作，咁樣對我哋嘅前列腺嘅病患咧進行呢一個診斷同埋治療，確保佢哋係可以獲得最佳嘅呢一個治愈嘅機會啦，係接受到最佳嘅醫療啦，同埋可以得到一種最好嘅生活質量嘅。
I'd just like to finish by saying thank you and also showing you some pictures of our team. So these are our radiation therapists on one of our machines. This is our physics team. This is the physical building of Chris O'Brien Lifehouse. And Professor Boyer is our Chief Medical Officer. And I think his statement is very important. We need to create the systems that ensure timely access to these innovative treatments for those who need it most. And hopefully we can make sure that no one is left behind.
最後想多謝大家啦，同埋有一啲圖片，包括係我哋嘅一啲團隊啦，一啲唔同嘅醫生啦、學者啦，我哋嘅 Lifehouse 醫院嘅呢一個喺 喺右上角嗰度啦，同埋我哋嘅波亞教授，佢係我哋嘅首席嘅醫生啦。咁佢都有講到話，我哋其實應該咧係打造一個系統，係俾我哋嘅嗰啲需要嘅人咧，可以及時同埋盡早咁樣嚟到獲得一啲前沿嘅研究或者治療方式嘅。
大家有冇咩問題想問醫生㗎？係。
For men who has prostate cancer and they take sexual performance drug like tadalafil, would that make the prostate cancer worse, or would it increase the progression of prostate cancer?
Sorry, do you mean the medications for erectile function?
Yeah, like tadalafil.
Yeah, so no, I can say I don't think that's going to have any impact on the prostate cancer itself. I will say that those medications are used very commonly after surgery and also after radiation, because the sexual function can be impacted by both those treatments for prostate cancer. So we actually use and prescribe those medications to men who are having difficulties in that area after their treatments.
And do you have any statistics like what the percentage of patients, if they diagnosed with early stage of prostate cancer, what's the possibility of spread to other parts of the body?
Depends on the type of prostate cancer, so I didn't go into that in a lot of detail today. But what we call the Gleason score is probably the most accurate assessment of how aggressive a type of the prostate cancer. So a Gleason score 6 is a low grade, a 7 is what we call an intermediate grade, and an 8, 9 and a 10 are the most aggressive prostate cancers. So the cure rates in a 6 or a 7, you're talking about, potentially 90% or 95% of men being cured in the low grade localized groups. But unfortunately the cure rates go down as the cancer gets more aggressive, and also obviously if the cancer has spread to significant areas such as the bone, then the aim of the treatment is to control the disease, but we won't be able to cure it.
So you said there are about 6-7 different type of prostate cancer.
There are multiple depending on the grade of the prostate cancer, and also what we call the stage, which means how far advanced it is. So whether it's in the prostate, whether it's gone to the glands outside of the prostate, whether it's gone to the lymph glands, or whether it's gone outside of the pelvis and has gone to the bones and other areas.
You mentioned the proton radiotherapy. Do you know when it will become available in Australia?
I visited Adelaide last year, so definitely the physical proton centre is there. But because of the type of machine that it is, it requires many, many months of testing. The other issue is really that when they've looked overseas at people having proton radiation for prostate cancer, they have found that they do equally well with the standard radiation than with the proton radiation. So it is a good treatment to have, but the other treatments are also very, very effective in terms of curing prostate cancer.
Last question, what causes prostate cancer?
What causes it, did you say?
What causes prostate cancer?
So by far and away, I guess the biggest risk factor is age. So we know that men who are older, obviously the risk of getting prostate cancer is a lot higher than in younger men. The second thing we know is that we are doing a lot more testing into the genetics of prostate cancer. I've definitely treated a number of brothers, so it can run in families, and we are specifically looking at mutations like BRCA mutations to test in men to see whether, if they have prostate cancer, whether their relatives or their sons will have an increased risk. So definitely, age is the strongest risk factor, but also we're looking more into the genetics to see whether, there is a hereditary kind of component as well.
Thanks very much.
我哋好幾個問題啦，一個一個講啦。首先第一個係如果係喺術後嘅話，有一啲醫生開嘅藥物方面係會唔會影響到我哋嘅前列腺癌呢？咁我哋醫生嘅回答呢係基本上係唔會嘅，因為有時我哋做完呢一個放射性嘅治療呢，喺其他嘅一啲部位，譬如直腸啊，同埋我哋嘅性功能呢，可能係會受損嘅。所以一般嚟講呢，醫生都係會開一啲藥物喺幫助病人喺呢方面減少相關嘅一啲副作用嘅。咁我哋第二個問題係關於我哋嘅呢一個治癒率啦。咁我哋治癒率嘅話，醫生啱啱亦都係有介紹到我哋有唔同嘅呢一個嚴重程度啦，同埋有唔同嘅呢一個分期嘅。隨着嚴重程度同埋呢一個癌症嘅分期咧，係會影響到我哋病人嘅呢個治癒率啦。如果佢係6到7之間嘅話咧，痊癒率可能係有高達90%到95%左右啦。咁如果佢嘅嚴重程度越高，咁我哋嘅呢個治癒率咧係成呢一個反比，就係會越嚟越低嘅。咁亦都有問到我哋嘅關於啱啱醫生介紹到嘅質子嘅呢一個新嘅機器啦，幾時係喺澳洲會投入使用啦？咁啱啱其實都有同大家介紹到，咁依家佢哋係做緊好多嘅測試，因為始終係一啲比較新嘅技術同埋科技，咁同埋依家係有研究指出話佢哋呢一種新型嘅呢個質子嘅呢啲機器同我哋傳統 X 光嘅機器咧，其實佢哋嘅效果咧都係一樣嘅，所以呢個亦都係會使到我哋會要考慮一下係咪其實真係需要用到呢一種質子嘅新型嘅機器。咁仲有一個問題咧，就係問到醫生係我哋嘅前列腺癌有啲乜嘢嘅成因啦。咁有一啲風險嘅因素嘅，其中最大嘅都係年齡啦。我哋隨着嘅我哋嘅病患或者男性年紀越嚟越大咧，咁佢哋患上前列腺癌嘅機率咧係越嚟越高嘅。呢一個係第一個啦。第二方面嘅話咧，就係我哋嘅呢一個基因嘅，因為喺過往從業當中咧，亦都係見過有一啲病人咧係佢哋幾個兄弟入邊咧，同時間都係患有呢個前列腺癌嘅，所以我哋亦都喺呢一個方面咧做緊一啲研究啦，包括係睇下有冇一啲基因嘅突變啊，或者當病患出現有呢一個前列腺癌嘅時候，我哋係咪幫佢哋嘅一啲譬如佢哋嘅仔啊、直系嘅家屬啊等等，亦都係做一啲嘅提前嘅檢查，睇下佢哋有冇患上呢一個前列腺癌嘅風險嘅。
你好，刚才听专家讲前列腺癌手术后，有没有这个遗留的证据？我想问一下，这些证据是什么？比如说，这个3年后 ，PS 值从0.01上升到0.05，这算不算证据？还有这个，当时的手术以后的这个切片检查是 GS9，这算不算证据？想请问一下，如果是这里头是这样的情况，就是说它有遗留的证据，大概在什么时期来做这个放射性治疗为好？用采取什么样的治疗方式为好？谢谢。
A question from our audience. You mentioned about the post-surgery radiation treatment. Just wondering, let's say that after the surgery, the PSA level has jumped from 0.01 to 0.5. Is that a evidence or a proof that the prostate cancer might come back, and whether when should be intervene, or what kind of evidence are we looking for to say that we do have a relapse of prostate cancer, and by then we should intervene with more radiation therapy?
So the PSA after surgery should be 0. It should be undetectable. So a PSA of 0.5 is a what we would call a biochemical recurrence. And before we gave any further treatment like radiation treatment or hormone treatment, I would organise a PSMA PET scan to see where that PSA is coming from. Is it coming from where the prostate was? Is it coming from a lymph gland area? Is it coming from the bone? We don't know. So the blood test tells us that there's prostate cancer somewhere, but we do the scans to help us target the treatment to where the prostate cancer is.
Just to clarify, the PSA level jumped from 0.01 to 0.05.
Oh, okay. Yeah, still 0.05. It should be 0. The PSA has to be what we call undetectable, less than 0.01 after surgery.
咁無論係呢一個係由0.01上升到0.05或者0.5咧，其實道理咧係一樣嘅。做完手術之後咧，我哋嘅 PSA 咧理論上應該係喺驗血報告嘅時候咧係低於0.01或者係檢驗唔到出嚟嘅。咁但係我哋咁樣嘅一個報告亦都唔可以去妄下判斷啦，我哋係需要可能醫生去作進一步嘅呢一個檢查啦，或者安排我哋啱啱講到嘅正子掃描啦，睇下究竟係身體邊個部位係佢其他嘅，譬如骨骼啦，我哋嘅佢鄰近嘅淋巴腺啦，淨係佢本身前列腺嘅嗰個位出現病灶，而導致喺血液報告嘅時候 PSA 嘅呢個水平係升高咗嘅。
Excuse me, Doctor. You mentioned earlier about the cyber life. It's only available in Perth at the moment. Any information how soon it's going to extend to the other cities in Australia? Thank you.
Again, the technology to some degree depends on cost and whether the centres feel like it is good value for money to spend multiple millions of dollars for a certain machine. In Perth, they treat both private and public patients. I've actually had patients who have consulted with the doctors in Perth to explore treatments there. But again, I would say that we do similar stereotactic radiation treatments on our machines at Lifehouse, and there is very little data to suggest that using a cyberknife or a linear accelerator is going to give you a significantly different outcome in terms of cure. So we feel, and I'm sure other centres feel, that the technology that we have is giving us equivalent outcomes compared to some of these newer technologies.
我哋都有另一個問題問到，包括啱啱介紹到嘅我哋比較新型嘅射波刀啦，佢可能會唔會依家淨係得柏斯先有啦？會唔會幾時可以比較普及啊？或者其他地方都有？咁我哋醫生嘅回答就係呢啲比較新型嘅技術咧，其實好多時候都係要睇我哋嘅呢一個預算啦，同埋我哋睇下政府佢哋其實包括醫學界係咪想真係用好多錢數以百萬計金錢跟住嚟到買呢啲比較新型嘅機器啦？特別係目前嘅話並唔係有好多嘅證據話呢種新型嘅呢一個射波刀嘅技術咧，係對比於我哋傳統嗰隻咧係有好大嘅呢個治療上嘅效果嘅呢個區別嘅。
Thank you. Thanks.